My name is Stephen Line. I'm a sports medicine physician here at Texas A&M University. I'm a clinical assistant professor with the College of Medicine, as well as the associate program director for the primary care sports medicine fellowship program. So sports safety and prevention, I would say, is a huge component of what we do. There's lots of literature and studies and different wearables that are going to be out there trying to reduce the risk of concussions. The more concussions you get, the higher the risk you are really for having long-term sequelae of a concussion. Obviously, there was a lot of media and news about chronic traumatic encephalopathy and some of the long-term effects, which CTE or chronic traumatic encephalopathy is more, at the moment, still a postmortem diagnosis. You have to actually get those pathological slides to be able to see, yes, is there some changes there? But as science progresses and medicine continues to advance, we see that there are still things we can act upon and intervene on earlier to try and reduce the risk of, cognitive dysfunction or dementia or some of the chronic headaches that people can get with repetitive concussions. There's no set number of concussions you have to have in order to be disqualified from a sport, but that being said, it's all about you as an individual, as a student athlete or patient when you come in to see us, as far as how we're going to treat that situation. So I tell people all the time that, if you've had 3 or 4 concussions in the back, you definitely need to be careful about how you're managing it going forward. But at the same time, you got to also see where the psychological component of, being involved in sports and is that healthy for you or not, and what's your risk profile. So, so if you were a football player, we can certainly still get you athletic and participating, working in team sports, but maybe a better avenue is going to be with track and field, where there's less of a risk of a head injury and a contact on a regular basis. So sport-related concussions are diagnosed. It's a clinical diagnosis for the most part. Oftentimes, if you have a really significant event, and we can all think about maybe a high school football player that gets a really hard hit on the field. They're laying there unconscious on the field. There can be a lot of excitement and kind of stress that goes into a moment like that. But especially if a student athlete is unconscious. And so oftentimes, if you end up getting transported to the emergency room and there's enough concern clinically that there might be something more dangerous happening, such as a brain bleed, then CT scans, CT imaging will be looked at the brain, or potentially an MRI. But most often it's a clinical diagnosis. Do you have a hit to your head that caused you to have some significant symptoms, whether that is, again, headache, neck pain, confusion issues, you're not following directions properly, you started missing plays. Those are all elements that, you might look for after a head injury. But the most common thing I would say would be headache. Beyond that, the diagnosis really is going to go into, again, a clinical exam. Oftentimes there's an athletic trainer or a coach that'll be at the sideline. Oftentimes in football, there's some requirements to have a team physician present. The management assessment initially will look like a field exam, and so we're going to check you for your eye movements. We're going to check to see if you have any specific areas of deformity in your head, any pain in your neck. Are you responding appropriately to questions? Is your memory intact? Those are a lot of the different features that will constitute a sideline exam. There's lots of different types of tests that are being implemented. Some are on the sideline, some are more office-based. But typically your main job as a physician is going to be to go, is it a concussion or not? It's very easy for me to be able to, say, hey, yeah, this could be a concussion. I'm going to pull you out of the game. But one of my biggest challenges as a sports medicine physician is to say, is this a concussion or is this something that's not? And you can actually get back to playing. I always want to try and keep our student athletes in the game if it's an appropriate and reasonable and safe thing to do so. But that's a very challenging decision sometimes. So it really takes a lot of confidence and repetition and experience to be able to know if that's a safe thing to be able to get them to do. The return to play process and just being knowledgeable about the whole process of a concussion, whether it's for a high school or middle school athlete or for a higher level athlete like at a club sport in a college or even an NCAA Division I level athlete. Have to be very familiar with, you can't just go, hey, yes, you were cleared from your concussion, you can get back into 100% into your activity. We really want to guide them through a graded process and reintroduction back into sport. And oftentimes there's a 5 or 6 step progression that we're going to ask you to go through. The goals change. The goal increases from just trying to increase your cardiovascular activity, make sure we're not provoking symptoms, to readiness and for sport-specific drills. A great example I like to give my patients when they come in to see me is there's a big difference between trying to get somebody who is on the tennis team back to serving and hitting compared to somebody who's a running back on the football team. Running back is going to go through lots of different demands. They're going to continue to be hit again, but we don't necessarily want to reintroduce them into being contact too quickly. So oftentimes we're going to have them get a couple days into their return to play program and high enough in that progression before we're going to reintroduce contact drills. So for football, for example, that's typically going to be you're putting in like a yellow jersey and you're protected up until the point where you get into a full unrestricted practice, and then you're finally going to get cleared back into play. But until prior to that, we're making sure that your fitness is ready. We're starting to work on your cardiovascular fitness, your strength training, making sure that you're all ready to go once you're actually put into a live scenario and you're finally cleared to return fully back into participation in your sport. Some other elements which are equally as important to the sports side is making sure that we can get our student athletes back into the learning side. It's really, really important, obviously, in my priority to get you back learning before you're even back in necessarily into your sport. We want to make sure that, of course, education is the high priority here. Making sure that you are tracking with your studies, whether that is homework or quizzes or tests. And a common thing that I see from providers that are not specifically adept at managing concussions is you're not thinking about the educational side. And so I give my student athletes and my patients return to learn protocols, which are going to focus on, okay, how can we push the limits but not create too much boundaries for you so that you're behind in your schoolwork and creating more psychosocial stressors. So just getting the buy-in from the teachers and professor level and principal level can be extremely helpful in just trying to set that student athlete up for success and returning to school, returning to their sport, and making sure that we're all on the same page as really a multidisciplinary team between athletic trainers, your physician staff, your principals, your coaches, and everybody else that impacts a student athlete's success in school and scholastic activity. I always explain to my patients that the eyes are the window to the brain. And so if using for an example here, if you get an ankle sprain, you're going to do some ankle exercise to try and get it to be stronger. For a concussion, the eyes are really the main avenue in which we can start to do some rehab. Physicians and healthcare providers that are adept at managing concussions will start doing something called a vestibular ocular exam. They're going to look for things like saccades and tracking dysfunction, seeing if you have any deficiencies or dysregulation in your vestibular ocular reflexes. We really want to ensure that when you are seeing that we're managing all the different components of a concussion.